Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about a subject that I come across quite often, and that has to do with radiation associated with imaging. And whether or not people understand when they're getting an x-ray or an MRI or a mammography or a CT, did I say CT, or MRI or ultrasound, like, is there any radiation and how much radiation is there? And it generally finds most people do not realize that there's radiation, or if they do, they don't really realize how much. And so this particular study looked at 2,866 people and asked them a couple questions about the imaging that they were going to be done. And I believe the study was done in Italy. But before I get to the results, there's a couple of things that I need to say. CT scans are done way too often when an MRI would be able to give you the same or better results. Now, to be clear, MRI and ultrasound do not have any ionizing radiation. And to be further clear, there's always some argument and has to do with, radiation hormesis, but there's a good chance that CT scans are over-CTing of the population leads to as many as 29,000 cases of cancer per year. Like, that's a lot from imaging that does not need to be done in many cases. I remember I had one year, a patient came into me at the end of January, and she's like, "Oh, don't worry, my deductible has already been met." It's like a $5,000 or $6,000 deductible. And she's like, "Oh yeah, I had a CT scan done of the chest, abdomen, and pelvis with and without contrast." That's 6 CT scans done at essentially the same time. That's ridiculous to do that when an MRI can frequently pick up the information that we need. And the reason we do CT scans is because they're quicker, and that means we can turn them over and we can get reimbursed better for them, especially in a hospital setting. It's ridiculous when a CT scan in a hospital setting costs, literally 10 times the amount that it would cost to have an MRI cash outside of the hospital. It's ridiculous. So, where is a CT scan effective? Well, when speed is important. So, like head traumas, if we need to see that there's a bleeding going, if there's a bleed in the brain, like an epidural hematoma going on, we need fast, and CT scan can do that. But there's some bone things that it's actually better at. If you have metal implants, then you frequently can't do an MRI because you're essentially in a gigantic magnet. So there are some reasons why people would have to have a CT scan, but there's so many more times when an MRI, which has no radiation, could be done, but we don't do it for practicality, or sometimes maybe the doctor just doesn't know any better and they're ordering the CT scan instead of the MRI. But so understand that CT scan has a much higher level of radiation than a chest x-ray does. And most people are actually not aware of that. In this particular case, 55% of respondents didn't know that a CT scan had more radiation exposure than a chest x-ray. And it's a lot more exposure. It's not just a little bit, it's a lot more. And over half of the people in this study, they're in the imaging center and they're not aware that they're going to be exposed to a large number of chest x-rays, essentially, by having one CT scan. 48% of the respondents didn't know that nuclear med imaging, so thinking about cardiac stress tests or PET scans, have radiation exposure with them. And as far as knowing that that there was radiation exposure, like, a good chunk of the people in the study didn't even realize that CT scans and mammograms actually have radiation exposure to them. So if you have enough over time, it can create some problems. So what does this mean? It means that you need to really ask your doctor, if they're ordering imaging, and if they're going to order a CT scan, then, God, do I really need this? It's the biggest question to ask, because frequently the answer is no. And the other thing is, can I have an MRI instead that doesn't have ionizing radiation that can cause DNA damage? So it's two really big questions that you need to ask if anybody's going to be ordering imaging, especially a CT scan. And make sure that, there's time and a place for them, but you got to make sure that the risk and benefit balances out. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe.